Hello, I'm Gary Korolev, founder and CEO of Sovereign Wealth Management. We're going to discuss Social Security and income planning today. We'll cover topics such as Social Security, Medicare, federal retirement benefits for federal employees, different types of retirement accounts, individual and employer sponsored. We'll cover long-term care insurance and long-term care costs, as well as other topics important when it comes to securing lifelong income. This is a webinar version of the in-person seminars and workshops that we do for many people here in the DC metro area and some other parts of the country at times as well. First, some disclosures. This information is going to be general in nature, given that I don't know any of the viewers' specific information. None of this information is actual advice. It's for informational purposes only. A little bit about our team. I'm Gary Korolev, the founder and CEO. We have Elena George as our Director of Operations. David Jeremiah is our paraplanner or financial planning associate. We have Katya, who deals with marketing, as well as Svetlana, who is a client service associate. This is a little bit about my family. This is us at the beach, and my wife and I with our 2 kids, and like to spend time at the beach in Florida when we can. But of course, the fall is always nice up here, up north, with the leaves and so forth. This is a 2-part workshop, and this is more relevant to folks who attend these seminars in person, but it may apply to someone who's watching online as well. The problem we started seeing is folks would say we're providing so much information at one time that they're finding it hard to actually absorb it all and apply it to their own individual situation. So the solution we came up with was we divided the seminar into 2 parts. First is this general discussion where we talk about these topics like Social Security, Medicare, federal employee retirement, 401k, IRA, long-term care, securing lifelong income. And then there's a part 2 where we deal with the individual. With each one of you who is interested, we provide a free of charge, fully customized, personal retirement plan and or consultation. People find it hard to believe, but we actually do follow through on that promise. When folks come to us through the door as new clients without attending our webinars, they often pay several $1,000s for our financial plans. People who attend our workshops and webinars, they do not, and seminars, they do not pay for these plans that we do for them. So, retirement done right. What does that entail? We have 3 portions of the pot. We have insurance, which encompasses Medicare, health insurance, long-term care insurance, and life insurance. We have the core income during retirement, which would be guaranteed retirement income, which would come from Social Security for most people, and maybe a pension if you were lucky enough to have one, and potentially for those who it makes sense for, an annuity which guarantees lifelong income, like a private pension would. Then the third part, the crucial part in these days of higher inflation protection and growth, in order to protect your income from degrading due to inflation over time. And that's your investment portfolio. And we're going to cover all 3 of these 3 parts to make sure you are aware of what it means to have your retirement done right from a financial standpoint. Let's start with Social Security. We'll go over the basics, we'll talk about timing, and we'll talk about different strategies. So the basics. When can you file? If you file at age 62, which is the earliest, you'll get 75% of your full retirement amount, which for retirees is between age 66 and 67, depending on when you were born. And the maximum benefit is 132% of the full retirement amount if you wait until age 70. The cost of living adjustment, we're looking at 3.7% on average since 1975. The last 20 years, it's been 2.15% because the inflation has been lower. Although 2023, 8.7%, a nice big increase. How does the government get the money for paying Social Security benefits? It's the FICA tax or the wage tax. So for individuals, up to $160,200 of your income per year is taxed at around 7.5%, and the other 7.5% is taken from the employer. So really, it's 13%, or close to around 13% of wages are taken by the government to pay for Social Security and Medicare. Maximum benefit at full retirement age is $3,627 for an individual. The average benefit for a married couple is $2,972, and for an individual is $1,827. To qualify for Social Security and for Medicare, you have to have 40 credits, and each credit is 1/4 of work, earning at least $1,640 per quarter or $6,560 in a year. How is Social Security taxed? So if you're single, the first $25,000 of your income, so if your Social Security falls into the income tax bracket where you are making less than $25,000 overall, including your Social Security, then your benefits are not taxable. For married, it's up to $32,000. For folks who are above $25,000 but less than $34,000, for single filers, 50% of the Social Security benefit is taxable. As you see here, for people who are single and make over $34,000, then 85% of their benefit is taxable. If you're married and file jointly, then if your combined income is over $44,000, then 85% of your benefit is taxable. Some factors to consider when deciding on Social Security strategy. So, life expectancy. You have to think about life expectancy of somebody your age, not in general. Some factors to consider when deciding on Social Security strategy. Life expectancy at your age, not in general. What do I mean? Now, for example, general life expectancy in the US is 76.8 years. However, that does not apply to you. That applies to somebody that was born today. For somebody that is closer to retirement age, for instance 62, life expectancy is 82 for males and 85 for females. You have to consider your health.
because often if someone is fairly healthy or has a lot of longevity in their genetics, in their parents and grandparents, then they're likely to live longer. And that has to come into the equation when you're thinking about whether to take Social Security at 62, 67, or 70. If you live longer, obviously you may want to wait to take your Social Security and get the big payment for longer, which will benefit you more, and vice versa. Marital status. If you're married, single, divorced, or a survivor, there's different benefits accessible or different strategies appropriate depending on your status. Employment status. Those receiving Social Security prior to their full retirement age and earning more than the earnings limit have benefits partially withheld. So that's something you have to think about. How long will you live? So, for instance, 5% of men live to age 100, and 5% of women live to age 102. 50% of men live to 89, 50% of women live to 90. And 25% of men live to 94, 25% of women live to 96. So you have to think about stretching your benefits, all of your income, and your resources throughout that life expectancy, but not only the average, but also have to think about these outliers, which still have a fairly good chance of happening. Married couples split strategy, 60-70. What is it? So the younger and the lower earner may want to begin taking their income at 62 and let the spouse's income build up until 70. And then the lower earner would switch to half of the spousal benefit or half of the higher earner's benefit. Here's an example. So let's say you have Sam, whose full retirement age benefit amount is $2,400, and Kathy, whose full retirement amount is $700 per month, and their full retirement age is 66. So if you look, the way the strategy would work, Kathy, because she has the lower Social Security amount, would start taking her income at 62 and provide the family with $525 per month. Then when the family reaches Sam reaches age 70, he now has a much larger benefit because he waited until age 70 and he gets the $3,168. At this point, Kathy can switch to the spousal benefit, which is half of Sam's benefit, and that way the family now receives a much larger benefit overall. If Sam passes away, then Kathy is left with the higher of the two benefits, which would be Sam's old Social Security benefit. And this is quite important in terms of planning because it's almost like an insurance policy. When you plan, you have to think about if your spouse is left after you pass away, if you're the higher earner, you want them in general to be as comfortable as possible. And one way to make them as comfortable as possible is to have as high of a Social Security benefit as possible, which would come only if you wait until age 70 to take it. Married couples. Should the lower earner wait until 70 or full retirement age? So if married, the lower earning spouse is entitled to their own or half the higher earning spouse's benefit, as we just discussed on the previous page. However, there are some caveats. So the worker benefit, or the higher earner benefit, it gradually increases by about, let's just call it 8% per year. And if you look at the spousal benefit increases as well. However, it only increases until full retirement age. After full retirement age, there is no reason for the spouse to wait for the spousal benefit to grow, because it won't grow anymore. However, the higher earner has to start taking their own benefit, and therefore their benefit will stop growing for the spouse to get her spousal benefit. So to be eligible for the spousal benefit, you have to be classified as married, which means you have to be married for 1 year. And you have to be currently married. And of course, again, the higher earner has to have begun taking their benefit. Divorced Social Security benefits strategy. So, are you entitled to your ex-spouse's Social Security benefits? Well, as long as you're single and both you and your ex-spouse are at least age 62 and your marriage has lasted for at least 10 years, then yes, you're entitled to your ex-spouse's Social Security benefit. And the divorce must have been finalized at least 2 years ago. So, if you're divorced, doesn't mean you're out of luck in terms of a Social Security benefit. You still have the choice of getting your own benefit or getting half of your ex-spouse's benefit. Social Security for widowers, survivors. So if you're a survivor, so if you have a spouse that unfortunately passed away, you can start taking the survivor benefit at age 60. Now, you'll only receive 70% of that benefit that you're entitled to versus if you waited until full retirement age. But at age 66, you get 100% of the benefit. Now, if you were disabled, you can start getting those survivor benefits as early as age 50. Now, one strategy that a survivor or surviving spouse has, which is quite beneficial, where the survivor can start taking the survivor benefit at age 60 while letting their own benefit grow until age 70 and then switching to their own benefit. This can be quite a windfall for many people. So when you're talking about survivor benefits, were you the current spouse or whether you're the former spouse, in both cases, benefits can begin at age 60, and if you were disabled, they can begin at age 50. Now, you have to be currently unmarried, and in the case of a former spouse, you have to have been married for 10 years. There are some exceptions to these rules, which can be discussed, but these are, in general, the rules. Some information regarding Social Security strategy for survivors continued here. If you look at the timing of when you can take your survivor benefits and the amount of benefits you would receive, it really depends a lot on when your spouse passed away. So if they are deceased and they did not file benefits when they passed away, and whether or not they died before or after full retirement age, so the decedent's full retirement age benefit plus any benefits for delayed filing, adjusted for survivors filing, is what you can expect to receive. If the deceased spouse did file for benefits, then the amount the survivor can expect to receive. Continuing with survivor benefits. So if the deceased spouse did not yet file for benefits, then whether or not they passed away before or after full retirement age, the deceased's full retirement age benefit plus any credits for delayed filing adjusted for survivor's filing age is what the survivor can expect in terms of a benefit. Now, if the deceased spouse did file for benefits, and if they filed on or after full retirement age, then the benefit amount the deceased was receiving at death, adjusted for survivor's filing age, is what the survivor would receive. If the deceased spouse filed before full retirement age, then the survivor can receive a benefit in the amount which would equal to the deceased full retirement age benefit adjusted for survivor's filing age, but limited to a maximum of the actual benefit of the deceased or 82.5% of the deceased full retirement amount benefit. And I know there's a lot here, so we can have a discussion about this in an individual setting if need be. So additionally, there are some benefits for survivors of disabled deceased spouses, because naturally, if somebody is disabled, they are more likely to pass away earlier. So this is a specific group of survivors which would be able to get this type of benefit. So group one would be if you're the survivor of such a spouse and you're between the age 50 and full retirement age, then or age 60 and full retirement age, and you would be able to receive between 71.5% and 99% of your spouse's disability benefit. And group two is you've reached your full retirement age, then you would be able to receive up to 100% of your spouse's disability benefits. If you're between 50 and 59 and also have a qualifying disability, then you can receive 71.5% of your spouse's disability benefits. Group four, if you're caring for a child under 16, then you're able to receive 75% of your spouse's disability benefits. Does working while receiving a Social Security benefit increase future benefits? The answer is maybe. A better answer, yes, but only if your earnings exceeded one of the top 35 years adjusted for inflation used to calculate your Social Security benefit. Now, the way Social Security is calculated is the last 35 years of your work history are taken, adjusted for inflation, and averaged out. So if you have a few years where you had zero earnings and you continue working while you receive Social Security benefits, then of course that zero is going to be replaced with whatever you earned that year. So that's going to help the calculation of your benefits for the future quite substantially. If you're making good income and you're replacing that zero out of that 35-year average, one of those zeros with a high number, a relatively high number for the average, that could really substantially help you in terms of increasing your future Social Security benefits. Inflation. Now, this doesn't seem to exactly fit into our discussion, but you'll see why I'm mentioning inflation, and I will mention inflation several times because it's quite crucial to our discussion and our strategy when we're thinking about Social Security and when to take it. So for instance, Loaf of bread, 2000, it was $1.26. Oops. 2022, it's $3.31. If we look at a movie ticket, $5.39 in 2000. In 2022, it's $12.69. Just some examples. Ground beef, $2.46 in 2000. 2022, it's $4.43. So quite a big difference. Now, why is planning so important? Here is Ron and Nancy. And let's look at a hypothetical example of this couple and how taking their Social Security benefits at different ages changes the amount that they receive over the lifetime. So Ron is 60 and Nancy is 58. Their monthly full retirement amount is $3,011 for Ron, $2,235 for Nancy, and the life expectancy is 85 and 90, respectively. And in this case, they start their benefit both at age 62. You can see here that their cumulative benefit, if they live until their life expectancy, is $1,659,000. The same Ron and Nancy are a little bit more patient. They wait and take their benefit at their full retirement age of 67. In which case, if they live until their life expectancy, they would receive about $300,000 more, $1,944,000. Here you have Ron and Nancy, who are very patient and both wait until age 70 to start taking their Social Security. In this case, you can see that they would receive a total of $2,126,000. You're looking at a difference of $467,000 between taking at 62 and at 67. So that clearly sounds like a big difference, right? Well, I guess it is to some extent. However, we'll come back to that a little bit later, just how big of a difference it is. Now, here we have some data on break-even, or when does it benefit you to take Social Security earlier versus later. So the orange line is if you took your Social Security at retirement at age 62, the aqua is 66, and the red is 70. You can see that the break-even between the three strategies is around age 76, 77. That's when it doesn't matter which strategy you use. They all break even. Cumulative payments by age over 30 years. So when are you ahead? So by what age does it help you to take Social Security early versus hurt you? So if we look at by age 72, obviously you will have had 10 years of getting your early Social Security benefit. Even though it's lower, you'd still be ahead. However, by age 82, you will have one out. So if you have the perfect adjustment for inflation, you will have one out by starting your Social Security benefit later at age 70. And you'll already see you'll be behind because you're getting so much a lower benefit if you started at 62. And if you look at age 92, of course, you're way ahead if you started at age 70, because that higher benefit really catches up and really continues to stay ahead and get further ahead of the lower benefit payouts. Let's look at inflation again. So has anybody heard of the Big Mac inflation index? So this is you could say somewhat anecdotal in terms of a way to gauge inflation, but it's quite an accurate way to gauge real inflation. And why, you'd ask, is a Big Mac includes many of the various parts of the economy, and because of that, it gauges inflation quite well. So for instance, bread, meat, those are agricultural products, sesame seeds, so that's agriculture, commodities, inflation. You have labor needing to prepare the food for you. You have real estate, the building where it was prepared. You have transportation, carrying all of this food to the location. So this is why this Big Mac inflation index has been talked about as a quite accurate bellwether of real inflation over time. So for instance, here's an example. And why are we talking about this, first of all? So if you're going to think about when you're going to take Social Security, whether you should wait or not, you have to think about inflation, because Social Security cost of living adjustments are based on the official CPI estimate, a variant of it. So the Consumer Price Index, if it's accurate, then you would think your inflation adjustments for Social Security would be accurate as well. If it's not accurate, if it's understating inflation, because if you are going to wait, you don't want the benefit of the higher income you would receive from Social Security to be inflated away. And one point of concern is the CPI, so the way the government measures inflation, whether or not it's an accurate predictor of inflation or an accurate gauge of inflation, because cost of living adjustments for Social Security are derived from the CPI. And so the Big Mac inflation indicator is actually a relatively accurate indicator over time, and that's because it encompasses most of the major parts of the economy. For instance, transportation, transporting the different food products to the factory and then to the restaurant. Labor, because the food has to be made for you. Commodities, because of all the different agricultural commodities that are in the burger. And then, of course, you have real estate, because of the building of where the food is made. So overall, it's been an interesting indicator over time. So if you look on the left, you'll see that if the Consumer Price Index, the official government estimate of inflation, is correct, then since 1993, the Big Mac price should have increased by 66%. And it should be priced at $3.78. However, and this is a couple years ago actually, the price of the Big Mac is to $5.06, or an increase of 122%. 66%, 122%. 66%, 122%. So Big Macs have gone up in price by twice as much as what the CPI would say they should have gone up in price, right? So at least based on this indicator, it looks like the government official inflation numbers are understating inflation by about half, which is, I guess, about what you'd expect. So now, going back to our previous chart, this $466,000, is that really what you're gaining by waiting until age 70? It's definitely something to think about or take into the calculus when you're making the decision. Another important point, the Social Security earnings limit. So if you start taking Social Security prior to your full retirement age, then if you make over $21,240, for every $2 over the limit, $1 is withheld from the benefit. And in the calendar year you turn full retirement age, for every $3 over the limit, $1 is withheld from the benefit if you make over $56,520. Okay, so what could end up happening is, even though you filed for Social Security, the government then withholds that money again and just makes it part of the calculation, adds it back into the bucket, so to speak, of your Social Security benefits when you reach full retirement age, and just pays you a higher benefit then. Again. Now, what's not counting towards this earnings limit are pensions, annuities, investment income, interest, veterans benefits, or other government or military retirement benefits. Only wages and net profit, if self-employed, is counted. So if you take Social Security at 62 and invest what is not spent to supplement income later, this is a strategy some have talked about doing, just want to start taking income as soon as they can. And what are some of the benefits of doing this? You have more control over the resources since the funds are in your pocket sooner. You have the chance to grow your funds and accumulate them over a longer period of time. You can potentially avoid higher Medicare costs later due to the income-based tax on higher incomes, because you won't be getting as high of an income later because you took your Social Security benefit earlier. So you lower the chance of being taxed at a higher bracket when you start receiving your Medicare. And you reduce the potential risk of the cost of living adjustment lagging real inflation, which is what we just talked about. Now, what are the downsides of taking your Social Security early? So it requires discipline. So of course, if you're taking that Social Security early, you want to make sure you're not spending the extra funds that you're receiving that you're really meant to save for later, or at least partially save and invest for future spending. So lower monthly Social Security check later in retirement. Of course, it's nice to get that check up front, even though it's less, but then later with inflation and with potentially healthcare needs, it really starts to weigh on you unless you have substantial other resources to supplement your income. Has to be planned carefully, given many who are still working and file prior to their full retirement age would simply have a large portion or their entire Social Security payment withheld due to the earned income penalty, which we just discussed. Social Security buyback. So let's say you started your benefits at 62 and you just change your mind. You don't want to keep getting the Social Security. Something may have happened where you received an inheritance. This has actually happened to one of our attendees before. You don't need the money anymore. You just wanted to let it grow because now you don't need it. You may want to kind of go back to work, or you went to our seminar and you realized that you want to build up that spousal survivor benefit because if something happens to you, you want your spouse to have a bigger benefit by waiting until 70. Well, the Social Security allows you to pay back your entire Social Security benefit you've received without interest, without penalty, as long as you do it within 12 months of filing. And you may have to amend your tax return if Social Security was already taxed on your previous return, if you want to recoup the lost benefit. Social Security Suspend strategy. So this is a strategy where you are receiving Social Security and you reach full retirement age, and now you say you want to stop your benefit, not pay back everything you've already received, however, just suspend it and let it grow. It can be for the same reasons we just discussed in the payback strategy, where you're receiving the benefit, you may want to go back to work, or you may want to just have your benefit grow for a few years. Here's an example of the benefits of doing so. So let's say John's full retirement amount benefit is $3,000, and John started taking at 62, and he was receiving $2,250, which is 75% of the benefit. You can only deploy the Social Security Suspend strategy if you started taking your Social Security early, before full retirement age, and then you reached full retirement age. So let's say here it's age 66 in this case. So John reaches full retirement age, and now he can suspend his Social Security benefit and let it grow again at 8% per year. And as you can see here, John at age 66 suspended his benefit and restarted at age 70. So the benefit had 4 years to grow, and he ended up back to about $2,970, which is what he would have had if he never started the benefit early anyway. So, and these amounts would be adjusted for inflation. These are very rough numbers, but it just gives you an idea of second chances, so to speak, that you can have when you take Social Security, and you may feel like you made a mistake in doing so after you've started receiving the benefits. Windfall elimination provision. So not a lot of people fall into this group, but I'm going to cover it quickly in general because it does apply to some folks, and for those who it does apply to, it's quite important. So if you are a person who received a pension which did not pay into the Social Security system, if you were not withholding, if your employer was not withholding FICA tax, so you probably have your own pension, and the government came out with this rule where if you did not then, after you were receiving this pension or after you worked for this employer that did not pay into Social Security, and then if you afterwards, maybe even if you had another employer, and that employer, for that employer you did not work more than 20 years, so less than 20 years, then the government would withhold part of your Social Security benefit because you're receiving the pension. Now, there's some pretty complex calculations that go into this, so we won't go into them here, but in general, the important point you need to understand is the most that could be withheld is up to half, is no more than half of your pension benefit. So if your pension is $1,000 a month, and you're also then entitled to Social Security, Social Security would not be reduced by more than $500. And the rest of the factors depend on the calculations that we could go over with you. The government pension offset. Now this is a happenstance where the entire spousal benefit could be withheld. So this often applies to if you have a primary earner who is able to get the Social Security benefit, but then the spouse, who normally would qualify for the spousal benefit, if that spouse worked for a possibly a pension system, or usually a municipality, like a teacher, they did not pay into the Social Security system, and then they're going to be getting a pension that pension could possibly offset the entire spousal benefit that they might receive. So for instance, here's an example where the spousal benefit is $900, and let's say there's a $1,000 non-covered pension that the spouse would receive. Well, if they receive a $1,000 pension, then the Social Security office is going to withhold 2/3 of that spousal benefit, which is $667. So the remaining benefit will be $233. So they would receive the $1,000 pension and then $233 of their spousal benefit. And then there could be a full offset where the spouse loses their entire spousal benefit. So for instance, if they have a pension which is $1,600 and 2/3 of that is $1,067, that's more than the entire spousal benefit, so they lose out on that entire spousal benefit for Social Security, but they still get their pension, of course. Let's talk about federal benefits. Federal employees, especially in the DC metro area, have some concerns around this area. They usually know their benefits pretty well, but we're going to go over some of them quickly. And so if we look at some questions that we get during our seminars, for instance, are FERS retirees eligible for FERS benefits and Social Security, so for their federal pension and Social Security? Yes, they are. And that's because federal employees do pay into the Social Security system. And the way that pension is calculated is, in general, years of service times annual average of highest 3 years times 1.1%. Sick leave gets added to pension calculation, but days fall off. So use sick days which don't add up to a month prior to retirement, meaning, so if you have 70 days sick days built up, 60 of those days will go towards the calculation for a pension, so that will increase your pension payout. However, the 10 days, they don't add up to a full month. You might want to just find a way to use those up, and if you potentially get sick right before you retire, it certainly won't hurt you in terms of your pension. Retire December 31st to get unused annual leave as a lump sum. So you have to wait until the end of the year to get that annual leave paid out to you. Pension starts the first of the month following retirement, so retire at the end of the month. Meaning, if you retire July 2nd, your benefits, the pension starts August 1st. If you retire July 31st, the pension still starts August 1st. So just wait till the end of the month. Keep working until the end of the month. So at least 6 months ahead of retirement, make sure your career documentation is up to date. And that's the standard Form 50 in the electronic official personnel file. And just pay attention to military time, part-time, intermittent service, leave without pay, because what has happened, it doesn't happen too often, but it can happen that there's kind of errors or misunderstandings in the calculation between the employee and the government, and maybe you have vacations planned, all kinds of different calendar happenings you have over the next year that you've set up during retirement, and then you may find out that you need to work another 6 months because you didn't have the numbers right. So this can be quite traumatic for someone unless they're fully sure that everything is correct. Medicare. For people 65 and older and those with disabilities, it is for citizens, legal residents, and those both citizens and legal residents have to have worked and paid into Medicare
for 10 years to get those 40 credits we talked about at the beginning, and who have lived in the U.S. 5 years in a row before enrolling. Initial enrollment period for Medicare is the 7 months around your 65th birthday. If already receiving Social Security, then you will be automatically enrolled in Part A and Part B. If you're still eligible for a group health care plan with your employer, you do not have to apply for Medicare until you retire. You just want to have documentation proving that you were part of you were covered by a qualified plan when you retire. If not covered by an employer plan and you do not apply during initial enrollment, then there's a 10% lifelong penalty for every year you're late to enroll in Medicare. The general enrollment period is the first quarter of every year, with benefits starting the following month. So that's if you miss the initial enrollment period. Part A is hospital insurance. It doesn't cost you anything. And you or your spouse, if you worked for at least 10 years, you will get the full benefit. It covers rooms, meals, nursing services, equipment, operating room. Part B is medical insurance. It's more similar to what you are used to at your work, and there's noticeable cost to it during retirement. You'll see the premiums. We'll talk about it a little bit later. You have the premium, the monthly premium, then you have the deductible and a copay or a 20% co-insurance. It covers doctor visits and services, outpatient care, clinic visits, emergency room, ambulance, preventative care, medical insurance. Part C is Medicare Advantage. So it's private insurance. It may or may not have a premium, depending on the plan. Covers everything Part A and B covers and more. And it has an out-of-pocket limit. Part D is prescription drug coverage. Covers all types and classes of drugs normally used by Medicare participants. And there's usually a premium and a copay. And drugs are covered based on tiers 1 through 6. Tiers 1 through 5, the higher the tier, the more expensive the drug covered and the more potential out of pocket. And tier 6 is a little bit different. It's kind of a wild card. There's a mix of different generics as well as specialty drugs in there. So Medicare supplement plans, Medigap plans, you may have heard of them, help pay some of the out-of-pocket costs. They're classified letters A through N. Same letter provide the same coverage, but they may differ in cost. Plans G and N are the most popular, and they're the most thorough in coverage. Most Medicare participants, they choose Part A, Part B, Medigap, as well as Part D, and that really is complete coverage. The cost for Medicare for most people, so if you're filing single and you are making less than $97,000 in 2023, or jointly and less than $194,000, then you are paying $165 per person. If you make more, then there's an additional premium you pay here. And there's a 2-year look back on your income for Social Security, for Medicare, and for figuring out what premiums you pay. The federal employee health benefit. So health insurance that federal employees have access to. The government pays 72% of the benefit in retirement. And to be eligible for it, you have to be eligible for immediate retirement, meaning eligible for pension at retirement, and have to have been a healthcare or a federal employee healthcare beneficiary for the last 5 years, meaning you will have
been covered by that plan for the last 5 years of employment. There's several options or strategies that federal retirees deploy here. So option 1, lower premiums, higher out-of-pocket costs, enroll in Medicare Part A only, and then the inpatient bills are covered by Medicare first, and then the federal plan pays second, and then the outpatient bills are also paid by the federal plan. Option 2, this is higher premiums but less out of pocket, enroll in Medicare A and B and keep the federal plan. Medicare pays first, and then federal plan pays second. Option 3, now this strategy, you cannot go back to the federal health plan. Enroll in Medicare Part A and B with Medicare supplemental plan, usually G or N. Now, all bills Medicare pays first and the supplemental plan pays second. Option 4, where you can suspend your federal plan with the option to go back to it. This is where you enroll in Medicare Part A, B with the Medicare Advantage plan or Medicare Part C. And then, so the insured pays co-pays, the Advantage plan pays the balance. Taxes and inflation in retirement. So we'll discuss tax rates in general. So we'll talk about where taxes are going. Let's now talk about some other aspects of retirement. We'll talk about Roth conversions, taxes and inflation, RMD planning. So if we look at the national debt, why do taxes go up? Well, partially, of course, the more debt the nation has, the harder it is to pay it off with current tax rates. So if you see here, the national debt as a fraction of gross domestic product, so if gross domestic product is your income, then the debt is how much you owe. You can see that we're actually not quite at record levels yet, but are certainly projected to go there. The only higher instance of where we had national debt higher than it is now as a percentage of GDP is to finance World War II. Okay, so in absolute numbers, certainly debt is at its highest level, but if you adjust it for GDP, we're almost there. Now, understanding your qualified accounts. So around $7 to $8 trillion in 401ks, through savings plans, 403bs. You have to make sure that you're dealing with that correctly, because there is no one watching those accounts but you, unless you have an advisor, of course. So starting in 2024, the IRA contribution limits will be indexed to inflation. So right now they're $6,500 if you're aged under 50, and $7,500 per year if you're 50 and older. Starting 2024, Roth accounts are exempt from required minimum distributions when they're in employer retirement plans. That was not the case before. And for student loan debt, starting next year, employers will be able to match employee student loan payments with matching payments to a retirement account, giving workers an extra incentive to save while paying off educational loans. That's interesting. 529 plans. So if you're helping save for retirement, maybe you have young grandkids and you want to be encouraged to add more money to those plans. After 15 years of the plan existing for any child, the 529 plan assets can be rolled into a Roth IRA. So if you have a child, a grandkid, maybe that has done really well and hasn't used up all the money in the 529 plan, or you funded the plan really generously, you don't have to feel like that money is somehow wasted. It's it can be rolled into a Roth to give that beneficiary, that child, a great start as a reward. And a total convertible amount is $35,000 into the Roth. Contribution limits for 401ks, IRAs. So for defined contribution plans at your employer, like a 401k or a TSP, so $22,500 plus another $7,500, so $30,000 if you're age 50 and older. And if you count employer matching for those same plans, you're looking at up to $66,000. Simple IRA contributions up to $15,000. IRA contribution limits of $6,500, and then you have the $1,000 catch-up if you're age 50 and over. TSP, or the Thrift Savings Plan. So this is the 401k-like plan which exists for federal employees. And these plans are famous for their low expenses. Big problem with them is limited withdrawal options and very limited investment options. The good thing about those investment options is they are quite low fee, inexpensive. However, those low expenses can be matched outside of the plan with some very low fee index funds. There is a potential to diversify those investments in the TSP with some other more specialized funds, because up to 25% of the account value can be put into a mutual fund through the existing new mutual fund window, but the maximum for that account can be only $40,000. Roth conversions. So you may have heard of this strategy, many have, and may have questions about it. So of course, a Roth IRA is after-tax money. So you have paid taxes before you put the money into the Roth. So then when you start taking withdrawals from the Roth IRA during retirement, then you're not paying taxes on those distributions. So now if you have a traditional IRA and you're thinking about doing a Roth conversion, every dollar you convert is going to be counted as income in that year when you convert. So why would you make such a move? Well, it only makes sense if there is a substantial drop in your income to where you were in a higher tax bracket, and now maybe you're both retired or retired for a period of time, maybe a year or two, and you want to lower the amount of taxes you will have when you have to take your required minimum distributions later in retirement. You anticipate higher taxes later in retirement. So you want to take advantage of this huge drop in income and your tax bracket by doing a Roth conversion. And so let's say you were making, as a family, $150,000. You were in a fairly high tax bracket. Now your income goes down to close to zero for a year. That's a great year to do maybe a $100,000 Roth conversion, so that you're taxed at those lower tax rates for that year. Or an $80,000 conversion, we'd have to look at the actual situation one by one. And then in the future, that money is available for tax-free withdrawals to control your tax bracket. Now, here is a strategy which allows someone to avoid their 10% penalty for early withdrawals or withdrawals from their IRA before age 59 and a half. So some folks, they may have come into a windfall, or they did really well and their IRA account has done really well, and they feel like, well, I want to live off of my IRA and I'm less than 59 and a half, I'm younger, but I don't want to be penalized that other 10% on top of the income tax I have to pay. Well, the substantially equal periodic payment strategy allows a investor to start taking withdrawals from their
IRA without incurring the penalty. So there's 3 calculation methods to deploy to figure out the eligible withdrawal amount. And you see here, for instance, John is 45 years old. He has $500,000 in the retirement account. And so these calculations are done. The amortization method allows for the biggest withdrawal. Oops. This here, so you're looking at $25,500 per year. So John can now withdraw up to this amount from the IRA per year up until he gets to age 59 and a half, at which point he wouldn't have any penalties anyway. Tax advantage life insurance. So this is a strategy where you may have heard of this. Sometimes it's called having your own bank and so forth. But really what it is if you have a life insurance policy, it's a permanent policy with a cash value, and it has investments in it that grow. And let's say an insurance policy where you're paying for $1 million worth of coverage on your life, of death benefit, $1 million, you are paying $1,000 a month for that coverage. So that's what you're paying for the insurance cost. Now, what if instead of just putting $1,000 a month into it, you put in $20,000 a month into it for a period of time, and you built up that policy to $500,000, or let's say $200,000. The cost of insurance is still only $1,000 per month. It did not increase. So the rest of the investments in the policy grow tax-free. So let's say that's grown now to $800,000 within the life insurance policy. Well, now you have this large amount of money which you can actually take out as a loan and use for other purposes without paying a penalty. Now, this has to be managed very carefully. There's a lot of rules around this, so it has to be done by a professional to make sure you don't break any of those rules and end up paying taxes. But this is one way to get tax-free growth. Now, a little bit about the markets. Very important because, again, if we're looking at that retirement done right circle, we talked about the pie chart, we have to make sure that we cover the markets as well for the investment portfolio aspect of your retirement. So inflation is, again, very important. I keep bringing it up from within different dimensions, so to speak, because you have to think about it in these different ways. So for instance, at an inflation rate of 6%, in 12 years, your income would be halved. So let's say if you have an income of $100,000, in 10 years, or in 12 years at a 6% inflation rate, that $100,000 needs to be $200,000 just to have the same level of lifestyle. At 4%, it's 18 years. So let's say you retire at age 65, at 83 at a 4% inflation rate, you will need to have doubled your income that you're used to living at age 65, just to feel that you're living at the same level. Now, markets and volatility. Getting back to even. This is very important for folks who are in retirement because they're usually living off of their savings. So if you lose 10%, at a 6% return, you're looking at 1.8 years to get back to even. That's without withdrawals. If you lose 30%, it'll take 6.1% to get back to even. If you start with $100,000 and lose 10%, you're left with $90,000. That's 11.1% gain you need to get back to $100,000. If you lose 30%, you're at $70,000. That's a 42.9% gain you need to make to get back to $100,000. Again, not counting inflation, not counting the withdrawals you're taking. So you want to make sure that, again, don't drop below the death zone, so to speak. You have the accumulation phase before retirement. Once you get into retirement, you want to preserve your wealth.
or at least grow it in real terms, or at least preserve it in real terms, but grow it in nominal terms, just to make sure you can fund the multi-decade retirement that you're looking for. Now, you just don't want the volatility to bring you down below a certain zone where it's going to be hard to recover with the withdrawals you're taking. So here's another example which is interesting in terms of calculating returns and how you should deal with returns versus actual real value of your account. So let's say you start with $500,000. You have a hot shot money manager that's made you 50% in 1 year. You're up to $750,000. All of a sudden he wasn't so hot anymore and he's down 50% the next year, so you're down to $375,000. At the end of this whole adventure, you're at $487,500. Officially, and this would be mathematically correct, that you have a return of 30%, 10% per year. So if an investment manager brings you a report and you both look at it together, you will see on there that you made 10% per year on average, or a 30% return. Well, you will say, what do you mean? I started with 500,000, now I'm at 487,500. So, well, that's the return. You've averaged a 10% return, but your value is 487,500. This is something you have to think about with the volatility, and you actually have to gauge real returns based on money you put in versus money you're taking out and what you actually end up with. And don't get too carried away with the percentages. Professional risk management. So many folks, obviously, and rightfully for many, are comfortable just setting their investments and forgetting, letting them grow, and that's okay. However, when you get closer to retirement, many understand that they need to control risk, or maybe to be a little bit more active around their investments. And so I'm just going to go over a few ways that your investment strategy can be aided by some very basic active management techniques. This is one of many hundreds of different strategies that are out there. But just to give you an example, risk management in terms of technical analysis. So for instance, this was COVID, pre-COVID, right here, early 2020. We started sensing the market's going to go down, reduced allocations in stocks, reduced risk. You have the big market crash in February, March. And then the Fed came in and stepped in with stimulus, and the Congress came in with stimulus checks. Market very quickly recovered. So very quickly you started also seeing a trend develop in the market. And then, so as long as you see a trend develop and the market stays in this channel, you can, at least from a technical perspective, from a trend following perspective, so to speak, as long as you're in this channel, you can feel pretty good that you can stay invested. Now, all of a sudden you saw this channel break, and you could see this as a potential beginning of a new downward trend. So you really become a little bit more careful, maybe start taking risk off the table while looking at other indicators as well. You had the new downward trend develop, and all of a sudden then you had a move to the upside where the channel was broken to the upside, bounced off what was now the floor, and that was a sign which told us that we could increase risk in portfolios. Macroeconomic indicators, because you certainly wouldn't just deploy technical analysis to control risk in your portfolio. So from a macroeconomic standpoint, there's 4 different quadrants. There's growth, and there's the growth axis, and then there's the monetary policy axis. So if you have growth decelerating and monetary policy easing, and the blue, by the way, is low inflation environment, orange is high inflation environment. So this is 60-40 heaven. So this, you have the US growth stocks and treasuries do really well. When you have slow growth with easy money, which is basically what happened from the great financial crisis on through 2020. if there's high inflation in that same environment, gold looks like a good investment. On the opposite end of that, if you have monetary tightening, while at the same time you have growth accelerating, then you have emerging market stocks do well, US value stocks, and credit do well. While if high inflation in the same environment, you have US value stocks do well, commodities, emerging market stocks. Now, obviously, I'm just showing you this as an example of the different variables that you need to take into account if you're trying to manage money actively, which is why most don't do it actively. It's a lot of work. Factors and economic cycles. So you can see here, there's different parts of the economy: recovery, expansion, late expansion, early recession, late recession. There's different factors which work in different types of markets. So size and value work in recoveries, momentum and value work in expansion. So you have momentum, low volatility, and quality work in late expansion. And early recession, you have low volatility, dividend yield, and quality work well in early recessions, and so on. So again, these are different perspectives you would take, different neighborhoods, so to speak, of the investment strategy that you would explore when molding your investment strategy overall. Macroeconomic indicators, for instance, right now, if we look here at the credit impulse, how much credit banks are putting out into the market, which is how they create money, put forward by 15 months, as you can see, the credit impulse is way down, way negative. So that's a tightening. Usually in that environment, earnings per share growth, which is what drives the stock market returns to a large extent, suffers. You can see that it's well correlated. We should see more of a downturn in growth of earnings. Currently, the consensus is that growth will be positive. Now, based at least on this indicator and some others, expectations are actually for a 10 to 20% correction in the market over the next few quarters. So the S&P 500 looked at two different ways here. So we have a sequence of returns, which is very important in retirement. So on the left, you have the S&P 500 from 2001 through 2020. If you have somebody that started with $1 million and he took out $50,000 per year. Now, at the end of 20 years, he will have $304,000 left. The average return in both cases is 6.91% per year. Now, on the right, it's the same S&P 500, but the years reversed. So 2020 through 2001. In this case, on the right, the investor also started with $1 million, took out $50,000 per year, but ended up with $1,619,000, $304,000, $619,000, or $1,619,000. So, what is the difference? The only difference is the first investor, the first 2 years of his retirement, he had big drops in the market, 13% loss and 23% loss. Whereas the second investor, those losses took place at the end of his retirement. So sequence of returns is very important. That's why we have to be more conservative in retirement. You don't want to depend on the market if you're taking withdrawals from your portfolio. In the history of bear markets, this last one, last year we looked at a 25.4% loss on average. It's been a 32% loss during bear markets. Now, one way which, with no fees, some of our clients have deployed capital to make safe returns. There are fixed indexed annuities. Now, annuities get a bad rap, and they're not right for everyone. This particular strategy, there is no guaranteed income. It's just guaranteed that by the insurance company that the income won't go down. So you have an investor here that put in $724,000. This was right before COVID. So during COVID that year, the portfolio made $118,000. Okay, now this was, as you can see, 5/06/2020. This is right after COVID happened. Now, most investor portfolios were way down at that time. This client made 16%. Now, if you have a year in the market where the market's up 45%, you certainly don't expect this strategy to hold up like that. But if you're in retirement and you're drawing money on your portfolio, and you have somebody who is just very kind of conservative and does not want big swings, then using a strategy like this, where you're guaranteed against losses and you get some of the upside in the markets, and you have indices which make returns maybe based on different criteria instead of just the stock market, then this may be a great way to diversify and reduce the potential losses and volatility in your portfolio. Now, longevity. When we're talking about retirement, longevity is, I guess it's a good thing because you get to live longer, but you have to make sure that you have the cash to cover it, so to speak. So healthcare costs is that big danger during retirement, right? Long-term care and so on. So 58% of women, 47% of men will need long-term care during their life. 2022, the average nursing home cost $8,100, assisted living $4,600. 2032, it's expected to go up. I think these are numbers which are probably underestimated. It's going to be higher than this. But $11,000 for a nursing home, $6,200 for assisted living in 2032. And I've had a nurse attendee to our seminar tell me that these numbers are actually lower than what the actual costs are. So, paying for long-term care. Medicare does not cover long-term care. Medicaid will cover it. However, you have to spend down your estate, and the government basically wants you to be pretty much destitute before you're able to qualify for Medicaid to pay for your long-term care expenses. So if you don't want to be destitute and you want to cover those expenses yourself, there are several different ways that you can do so. One of those is long-term care insurance, annuity with a long-term care rider, and life insurance with a long-term care rider. So here's the pluses and minuses of both of them. So traditional standalone long-term care insurance, the premiums per every dollar of coverage are less or cheaper, but you will have premium increases at times, probably. And if you don't use it, you lose it, right? It's like car insurance. Hybrid life insurance with long-term care benefits. So this is where you have a life insurance policy. Let's say it's for $1 million worth of coverage. And if you need long-term care coverage, then long-term care is covered from that death benefit. So let's say you have a policy that's for $1 million. Your long-term care ends up costing $400,000, and then you pass away, then there's $600,000 left of the death benefit that goes to your beneficiaries. Of course, it's going to be more expensive than regular long-term care insurance, but there is no increases in premiums, and there is still a death benefit left over for your heirs. Annuity with long-term care benefits. Of course, because it's an annuity, you're paying a large upfront premium, but there are no premium increases and the underwriting is easier. Now, here is a specific approach which we actually produced this illustration as part of a financial plan for a client of ours, and you can see here, and this is partially how you can get long-term care coverage through an annuity. So a client deposited $720,000. They are guaranteed 7% per year guaranteed income for life starting at age 69, and a 10% increase in guaranteed income every year that they don't take money out. Also, if this investor has a long-term care event, as long as there's still cash value in the policy, income doubles, and doubles for up to 5 years if long-term care is needed. And the income base off of which the guaranteed income is calculated is also increased instantly by 25%. So they put in $720,000. The income base increased to $900,000. So they had growth in income for 2 years, and at age 71 they started taking the income. They're receiving $61,500 for the rest of their life. If they have a long-term care event, again, as long as there's cash value in the policy, they'll be able to receive $123,000 per year for up to 5 years. So we just covered in general terms different strategies that are available. So when you get further professional help, if you choose to do so, and if you choose to work with a financial professional, just make sure you're working with someone who you feel understands your needs and who you feel puts your best interests first, who are education focused. They provide you with a written retirement plan, and there's communication, and you feel comfortable and appreciated for how you work with them. Now, part 2 of our workshop is where you schedule your complimentary consultation, get the tax-efficient investment plan, and get a comprehensive retirement income plan.